This
My
meeting is
DNP.
now being recorded.
Hello, my name is Sheila Mady. I am here today to present my DNP capstone titled Faculty Perceptions of Teaching, Caring in Nursing Curriculum, Affective Learning Domain. First, I would like to extend my deep gratitude and sincere thanks to the faculty of American Sentinel University, to my committee members, Dr. Michael Landry, my chair, Dr. Tona Leiker, and Dr. Susan Laburel. Thank you for sharing your gifts and talents. You have made this journey incredibly memorable and rich. A shift from a technical-centric focus to a more emotional and humanistic aspect of nursing care, personified in affective learning domain, which are values, attitudes, and behaviors, has sparked an interest in how nurses are educated in the professional development of caring. Professional development of caring practice meets patients' emotional and psychological needs, which creates a satisfying caring experience for patients and nurses. In the world of nursing education, this expectation of caring integration aligns with the essentials of baccalaureate education for professional nursing practice. Development of caring practice behaviors is reflected in affective learning domain. While this learning domain is often overlooked, research supports that educators suggest the affective learning domain is perhaps the most important domain to be taught. Consequently, practices related to affective learning domain need to be identified and integrated into nursing education. Therefore, the outcome of this project was to assess nursing faculty's perception of teaching caring in one nursing program. This was done through the use of the Caring and Nursing Curriculum Design Instrument, using an electronic survey method. The instrument was distributed to faculty within a rural, public, state-based university, College of Nursing, where faculty prepare baccalaureate pre-licensure nursing students. So my problem statement. Nurse educators focus on measurable outcomes within the cognitive and psychomotor learning domain, but fail to include the affective domain. In order to meet patients' emotional and psychological needs and subsequently create a satisfying caring experience for patients, a nurse's objectives related to affective learning domain need to be identified and integrated into the nursing curriculum. Background. Nursing education is charged with the preparation of nurses for professional practice grounded in caring behaviors. The foundational contribution to nursing practice is exhibited in the practice of caring within the affective domain. Quality professional nursing practice requires a maturity of not only knowledge and skills, but caring practices reflective of those values, attitudes, and behaviors. Nursing practice encompasses decisions made for the advocacy of patients. This decision-making process is founded in values, attitudes, and behaviors, that which, when exhibited, increase patient satisfaction, evidenced in positive patient outcomes. The supported caring attributes are moral obligations of professional nursing and should be introduced in the nursing curriculum and cultivated within the affective learning domain. Given the foundational contribution the affective domain offers to nursing practice, nurse educators are challenged to view and integrate caring objectives encompassing the affective learning domain so that nursing graduates not only have the knowledge and skills for competent practice, but the values, attitudes, and behaviors to provide safe, humanistic, quality care. Purpose. Nurse educators are asked to embrace the affective learning domain so that nursing graduates not only have the knowledge and skills for competent practice, but also those values, attitudes, and behaviors that are reciprocative of a caring attitude. This caring attitude is the foundation to provide safe, humanistic, quality care. A cross-sectional descriptive survey design provided the opportunity to assess nursing faculty perceptions on teaching caring in the nursing curriculum. Therefore, the purpose of this cross-sectional descriptive survey of nursing faculty within one rural public state-based university, College of Nursing, was to assess faculty perception of teaching caring in the nursing curriculum. My project question: what are the perceptions of nursing faculty on teaching caring in the nursing curriculum? Gene Watson's theory of human caring provided the theoretical framework for this project. The goal of this theory is to elucidate the caring perspective of nursing education and nursing practice. Watson emphasized that caring practices among nursing remains a challenge despite almost 3 decades of study. Fundamental caring behaviors evident in values, attitudes, and behaviors are essential to the affective learning domain and separate the doing from the emotional quality of nursing. Unfortunately, the significance of the affective domain specific to caring attributes of professional nurses is often challenged because of the hurried, task-oriented, impersonal nature of our contemporary healthcare environment. In reality, the very essence or foundation of the profession may be fractured. A caring relationship represents a special kind of human being, a connection with another human being, a high regard for the holistic being and their existence in the world. Caring is viewed as the moral duty of nursing, where there is the utmost concern for human dignity and preservation of that dignity. Human caring begins when the nurse enters the intimate world of the human being. Watson's model is the interconnection that exists between the nurse and the patient as a convergence where caring occurs, thereby developing and processing of caring from one human being to another. As diverse as this theory on caring may appear, it facilitates a holistic approach to patient care and treatment. The simple yet intricate human-to-human caring process in nursing is an essential foundation from which a caring relationship can emerge. The nurse enters the intimate world of the human, considering the person as unique who embodies the disease or illness. The nurse's caring presence and conscious awareness of professional self stimulates an environment where trust is established, which allows for a healing setting. This process, according to Watson, is harmonious with Nightingale's model of putting the patient in the best condition for nature to heal. Watson's approach stresses the engagement of caring and healing within a model that cultivates a working relationship between technology, humanity, and the broader world. Watson foresaw her theory as a lens through which the profession of nursing could view its traditions, which are grounded in the principles of health and healing. The practice and knowledge necessary for an education program incorporating a caring healing framework requires an amalgamation of influences from the arts and humanities, along with expanding human sciences that takes into account the union of both. Influences from the arts and humanities are the foundational essence of nursing curriculum. Nurse theorists, mainly Leninger and Watson, are well known within the literature and suggest in order to restore the heart of nursing and establish a foundation of caring within the nursing practice, a transformation needs to occur. With that being said, the integration of caring is highly dependent upon two factors: nurses' understanding of the affective domain of patient delivery, and nurse educators' incorporation of aspects of caring in professional development curricula, which is the outcome of this project. Now, there were three themes that emerged in the literature. The first one was caring. The American Nurses Association broadened the definition of nursing to include the establishment of a caring relationship, engaging a greater importance on the caring theory within the profession of nursing. Caring is considered in the literature as the central focus of nursing and reflected as the art of nursing, an exemplary skill of caring. Caring education is one type of affective teaching expressed as a value, attitude, and behavior not to be limited to a single course, but across a nursing curriculum. Educational assessment begins with the integration of affective learning objectives that guide instruction and support the assessment of learning outcomes, particularly when teaching to those values, attitudes, and behaviors within the affective domain. Nursing education. Nurse educators focus on measurable outcomes within the cognitive and psychomotor domains of learning, but nurse educators are asked to embrace the affective domain. The practice of nursing calls for the professional nurse to frequently engage him or herself in a humanistic value system that is combined with the scientific knowledge foundation vital to the nurse's caring. Engagement is a part of the didactic and pedagogic discipline of caring science, and as an engager, one is a carrier of a personalized paradigm of caring science. The challenge and aim of engagement is to confront students and support them in the learning process to become a caring nurse. To study nursing is to study caring, to grow in an understanding of self and others as a caring person. The didactic challenge is a pedagogic fact, or the process that promotes refinement in today's nursing education. This combination of humanistic scientific values and knowledge function as the foundation of the science of caring. Affective learning domain. Classical work of Bloom established the measurement of learning outcomes with a detailed taxonomy of educational objectives. Affective objectives are attained when students realize an appropriate level of internalization or value for the content. This internalization or self-knowledge within the affective domain is strongly related to the intellectual growth of college students. Acknowledging the affective domain is the most overlooked of the three domains. Attention to the affective domain can provide students an opportunity to internalize emotions to make sense of one's cognitive and psychomotor learning. This implementation project utilized a cross-sectional descriptive design to survey faculty who prepare baccalaureate pre-licensure nursing students of perceptions of teaching, caring, and nursing curriculum. Lorraine Brown in 2005 developed the questionnaire, Caring and Nursing Curriculum Design Instrument. The instrument's validity is supported by a content validity index of 0.93, and reliability is supported with an inter-rater reliability of 0.79. There are 5 sections to the questionnaire. Section 1, Caring and Nursing Education, consisted of 14 closed-ended items on a 5-point Likert scale, which measured 3 major value, attitudinal, and belief constructs. Section 2, the Caring Learning Objectives, consisted of 1 question with 5 response options along a continuum to express belief about the importance of including caring, affective learning objectives in course and or curriculum development. Section 3, Curriculum Design and Teaching Practices, consisted of 9 Likert scale items measuring faculty use of caring, affective learning objectives in the curriculum. Section 4, Use of Hierarchical Learning Objectives, consisted of 9 Likert scale items to identify the respondent's experience with caring affective objectives in the curriculum or course design. Now, due to the uniqueness of nursing faculty makeup, such as 2 male faculty members, and the sample size, demographic data, which was Section 5, was not collected because the data could be used to identify each respondent. A convenient sample size of 37 was obtained from the 119 online surveys distributed for a return rate of 31%. Research found that when surveys were sent to a group reflective of nursing faculty within the rural, public, state-based University College of Nursing, the response rate was 50%. Another source, SurveyMonkey, suggested a response rate of 20 to 30% to be considered highly successful. Therefore, a response rate of 31% was acceptable for this project. The sample in this project are homogeneous and consisted of nursing faculty employed in a rural, public, state-based university who facilitate education of baccalaureate pre-licensure nursing students. Nursing faculty were identified through the rural, public state-based University College of Nursing domain public website, which was readily available. Online contact provided a project introduction, an invitation to participate. Willingness to complete the secure survey was considered to be consent for this project. SurveyMonkey 2014 was utilized for its ease of use by faculty completing the survey and by the researcher in the data collection and analysis process. The data collection period occurred over 3 weeks to accommodate the winter holiday schedule, with a reminder sent at the beginning of week 3 to maximize the faculty's response to the invitation to participate in the survey. An electronic communication was sent to each potential participant with the following information: an overview of the capstone project, including the purpose, length of time to complete the survey, rights of participant, a confidentiality statement explaining how the data will be collected, analyzed, and destroyed per protocol, contact information for the researcher if questions arose, and a link to the electronic survey. A reminder email was sent 3 weeks after the initial request to maximize the participant response rate. Data were analyzed using Microsoft Excel, which offered an organized and consistent analysis of the data. Percentages and median values for all response to each item in sections 1 through 4 were computed. Prior to the implementation of this project, written and verbal approval to utilize this questionnaire was obtained on June 24, 2014 from Dr. Lorraine Brown. Approval was obtained from American Sentinel Institutional Review Board, from the Rural Public State-Based University College of Nursing Dean, and from the Rural Public State-Based University College of Nursing Institutional Review Board. The rights of the human subjects to full disclosure, confidentiality, and anonymity were protected. Data collected will be stored within SurveyMonkey. No participant identifiers were collected. All downloadable data from the survey is secured in a locked file, and any print documents of the data will be securely shredded 5 years upon completion of this project. The survey site was encrypted so that respondent email addresses were not collected to protect the confidentiality of participants. Findings. Section 1, which was the caring and nursing education, consisted of 14 closed-ended items on a 5-point Likert scale from strongly agrees to strongly disagrees, with numeric values ranging from 5 to 1, which measured 3 major value, attitudinal, and belief constructs. Description of caring and nursing education more closely aligned with the beliefs and relevance of caring and nursing education, which yielded 83%. Attitudes and beliefs about the inclusion of caring concepts in nursing curricula yielded 56%, and general beliefs about caring and nursing education yielded 58%. Now, faculty who were uncertain, disagreed, or strongly disagreed that caring could be taught also believed that caring could not be evaluated measurably, and that teaching caring attitudes could not be planned in the nursing curricula. Section 2, Caring Learning Objectives. Frequency distribution and mean scores of Section 2 that consisted of 1 question with 5 response options along a continuum were analyzed to express belief about the importance of including caring affective learning objectives in course and or curriculum development. Results validated as 46% were extremely important, 32% very important, 8% important. Therefore, the inclusion of caring affective learning objectives were perceived as an important element in curricular design. Section 3, Curriculum Design and Teaching Practices. Section 3 consisted of 9 Likert scale items, which measured faculty's use of integrating caring affective learning objectives in the curriculum. Frequency distributions of the three types of learning objectives, which were cognitive, psychomotor, and affective, were analyzed using descriptive statistics to determine the faculty's use of the various taxonomies. Responses categorized as always and frequently were grouped to determine high frequency, and responses of sometimes and occasionally were grouped to denote infrequent practice. Cognitive learning objectives were most often included in the curriculum, which yielded 89%. This was closely followed by psychomotor learning objectives, which yielded 61%, and affective learning objectives were included by 54% of the respondents. Section 4, the use of hierarchical learning objectives. Section 4 consisted of 9 Likert scale items, which identified the respondents' experience with carrying affective objectives in the curriculum or course design. Responses categorized as always and frequently were added to indicate high frequencies, while those categorized as sometimes and occasionally denoted low frequencies. So most of the respondents design or facilitate courses that are based on Bloom's taxonomy of educational objectives. And the original version of the taxonomy were used more often than the newer version. Exploring the faculty's experience with hierarchies within Bloom's cognitive domain, first assess the faculty's experience with hierarchically structured educational objectives. The cognitive taxonomy is designed to be hierarchically and is reflected by the practice of 54%. Frequencies were also analyzed for the first 3 levels of hierarchically developed affective learning objectives. Approximately the same number of respondents never using carrying affective objectives at the receiving level, which is the first level of hierarchy, yielded 13%. The second level of responding also yielded 13%, and the third level, which is valuing, also yielded 13%. Now, respondents who identified that they always and frequently use objectives at the receiving, responding, and valuing levels of the hierarchy were cross-tabulated against the respondents who identified that they always or frequently include hierarchical carrying affective learning objectives in curricular design. Now, these results indicated that 55% of those respondents use objectives at the receiving level, 30% at the responding level, and 32% at the valuing level. These findings indicate that hierarchically leveled objectives are inconsistently applied in the design of nursing curricula. Interpretation of findings. This DNP project sought to describe nursing faculty's attitudes and beliefs regarding the inclusion of caring concepts in the didactic components of nursing education, and to explore the faculty's practice of curriculum design and facilitation that includes caring outcomes within the affective learning domain. There is ongoing transformation for nursing curricula with movement from the behaviorist approach to education to philosophical approaches that uphold the humanistic, caring perspective of nursing. However, nursing programs continue to be driven by learning objectives and measurable outcomes characteristic of the cognitive learning domain. The literature supported the importance of integrating affective domain characteristics into nursing curricula. The outcome supports affective characteristics such as those values, attitudes, and behaviors. Those characteristics which literature has tied to the caring aspect of the affective learning domain provide evidence to the nurturing aspect of providing care to support the transformation and restoration of the heart of nursing, which is caring. This DNP project was supported by Jean Watson's theory of human caring. The goal of this theory was to elucidate the caring perspective of nursing education and nursing practice. The implementation project utilized a cross-sectional descriptive design to assess faculty perception of teaching, caring, and nursing curriculum through an online survey. Data was analyzed using Microsoft Excel in order to effectively assess faculty perception of teaching, caring, and nursing curriculum. Data obtained from the survey were presented by percentages and median values for all responses to each item in sections 1 through 4. The research questions specific to this DNP project: what are the perceptions of nursing faculty on teaching, caring, and the nursing curriculum are summarized as follows. The respondents' general attitudes and beliefs about caring and nursing education showed more diversity, as reflected in 56%, than their beliefs about the relevance of caring and nursing education, 83%, and the integration of caring into nursing curriculum education, which was 58%. Inferences about the important findings: the faculty's descriptions of caring and nursing education were measured by responses to attitudinal and belief statements and were consistent with the conceptual and theoretical descriptions offered in the literature. Additionally, their description was most closely aligned with concepts related to the relationship of caring to nurse education than to the actual integration of caring in the nursing curriculum. Nevertheless, analysis of frequency distribution and mean score indicated that the faculty perceived including caring, affective learning objectives an important aspect in curriculum design. The data also revealed that while the faculty designed and facilitated courses that include significant were less frequently used. An equally significant finding was the infrequent use of caring affective learning objectives designed hierarchically in the nursing curriculum to facilitate nursing students' internalization of caring attitudes, beliefs, and values. The infrequent integration of caring affective objectives in curriculum design and hierarchical leveling of caring affective objectives may be explained by the number of faculty who either disagreed or were uncertain of their ability to teach caring attitudes in the classroom or measurably evaluate caring outcomes. So the implications of analysis for leaders are within the constraints of the behaviorist approach, which require planned, intentional restructuring of the presently used teaching modalities. The nursing faculty's attitudes will then be more consistent with their expressed beliefs about caring and nursing education. The faculty must be mindful not to minimize their role in teaching caring constructs by assuming that everyone is capable of caring within the context of the nursing process. Faculty must explore the human potential as worthy to be envisioned, imagined, experienced, learned, and nurtured. An attempt to reconcile differences between the faculty's beliefs and attitudes about caring may result in the delivery of a curriculum that is not internally consistent with the expected outcomes for nursing education. It is recommended, then, that nursing programs consider adopting one of the many available caring theories or research-based models as a framework for curriculum design to more clearly depict the essence of nursing, from which expected graduate competencies for student nurses may more readily flow. Watson's human science and human care theory contend that the human care process of actualizing curative factors is preceded by knowledge and clinical competence. The integration of humanism into nursing curricula, particularly those aspects that reflect the caring perspective of nursing, can no longer be an option for nursing education. The data suggests that there may be some misinterpretation or lack of knowledge of the hierarchical structuring of caring affective objectives. Further exploration of the faculty's knowledge of the development of affective objectives in curricular design, as opposed to practice behaviors explored in this project, may create professional development opportunities for the faculty. It is further recommended that more objectives written in the affective domain of learning, and specifically caring affective objectives, are included in the nursing curricula. Hierarchical leveling of affective objectives may be a secondary gain as the faculty redirects the focus from a preponderance of cognitive and psychomotor objectives to include caring affective learning objectives. The significance Affective learning is a type of learning that expresses the emotional and belief system of those who support attitudes and professional values and behaviors, which is significant in the caring profession of nursing. Attention to the affective learning domain can provide nurses an opportunity to internalize emotions to help make sense of one's cognitive and psychomotor learning. Although the cognitive domain is focused on the acquisition of knowledge and the achievement of skills, is evident in the psychomotor domain, the affective domain focuses on nurses' values, attitudes, and behaviors of the nursing profession reflective of caring. Literature emphasized teaching to all three domains of learning, cognitive, psychomotor, and affective, through the affective domain. Although the affective domain is ill-defined and difficult to measure, many values in nursing derive from this domain. Internalized emotions expressed as values, attitudes, and behaviors are significantly recognized in order for the development of professional caring. The significant contribution to the nursing profession comes in the form of caring within the affective domain. A key factor of the affective domain is the caring values, attitudes, and behaviors necessary in the achievement of critical thinking, which assures quality nursing care. Critical thinking has a caring or affective component, so in order to assure quality nursing care, nurses must become aware of their own values, attitudes, and behaviors in order to understand and reciprocate caring practice towards a patient. So how a nurse behaves at the bedside is reflective of values, attitudes, and behaviors, of which originate with the student and is the responsibility of the nurse educator. So quality nursing care requires the maturity of not only knowledge and skills, but of those values, attitudes, and behaviors. Defined in the literature as the quintessential hallmark of professional nursing practice, caring has been conceptualized as a human trait, an affect, a feeling, and a value-based intentionality, which when exhibited increased patient satisfaction evidenced in positive patient outcomes. These caring attributes are moral obligations of professional nursing and should be introduced in the academic environment and cultivated within the affective learning domain. So recommendations. The project sample consisted of nursing faculty employed in a rural public state-based university who facilitate education of baccalaureate pre-licensure nursing students. This group of faculty already recognized the value of caring curriculum. The faculty's belief and attitudinal differences regarding the ability to teach caring in the classroom and to measure caring outcomes could be used as a basis to open dialogue among this group of nursing faculty with support and encouragement from nursing program administrators. The following are recommended topics for discussion among this group of nursing faculty to further explore the development of a caring curriculum. What criteria do the nursing faculty in defining caring and nursing education use? How does this particular faculty define caring and nursing education collectively? What knowledge is needed to facilitate the inclusion of caring constructs in curriculum design and implementation? What are the differences and similarities in the inclusion of caring constructs in the classroom from clinical practice? How should caring be integrated into the nursing curricula? What factors inhibit and promote the inclusion of caring affective objectives in the design of the nursing curricula? What factors inhibit and promote teaching caring affective behaviors in the classroom? What are examples of caring affective learning objectives included in the nursing courses? What strategies can be used to evaluate the affective dimension of caring and nursing education? And what criterion is utilized by the faculty to determine that a student is caring within the context of the nursing process? This dialogue among the faculty could be a precursor to the faculty's identification of their own caring behaviors, thus facilitating the teaching and evaluation of caring behaviors of their students. Recommendations for future research. The findings of this project suggest the need for further research to examine nursing faculty's practices related to the integration of caring constructs in the design and implementation of this curriculum. Replicated studies with larger samples of nursing faculty from a wider biographical or geographical area and studies of nursing faculty that include both the private and public sector would be instrumental in strengthening the finding of this project. Implementing some level of environmental control also could strengthen this project. While the self-report format was appropriate for collecting data related to the perceptions, beliefs, attitudes, and values measured in this project, validated practices could be supported with more concrete evidence. The design of the project could include the actual collection and review of course objectives from the various nursing programs to identify the inclusion and hierarchical leveling of caring affective objectives and yield more objective data. A more objective data collection could clarify some of the incongruencies noted between the faculty's expressed beliefs and actual practices. This clarification could serve to identify areas for further exploration related to curriculum development. This project may also have implementations in other health-related fields where caring and effective constructs are taught, measured, and evaluated in the classroom and transferred to the clinical setting. Scope and limitations. The scope of this project includes the utilization of a valid and reliable tool which yielded usable data to assess nurse faculty perceptions of teaching, caring, and nursing curriculum. This implementation project consisted of a survey utilizing the caring and nursing curriculum design instrument to assess faculty perceptions of caring and nursing curriculum at one rural public state-based undergraduate pre-licensure baccalaureate college of nursing. 37 nursing faculty completed the electronic survey received from one rural public state-based undergraduate pre-licensure baccalaureate college of nursing. This limited the generalization of the results. The following slides would be my references, and I very much appreciate everyone attending my presentation today.